Are your patients barefoot? Are you losing treatment because of that? Particularly periodontal therapy, but lots of other things too. And are you paying too much that you don't have to pay every time a patient gets treatment? Wow, we got so many things to talk about on today's episode of the Dental Practice Fixers podcast. I'm Dr. Richard Maddow. I'm co-founder of the Maddow Center for Dental Practice Success, and I am your host today. So last week, I was sitting in a coffee shop in Seattle, Washington, the beautiful Pacific Northwest, 20, not 20, 2,759 miles from my home in Baltimore, Maryland. And the person in line in front of me was ordering something like, those crazy orders like I'll have a double caramel skinny oat milk matcha latte, low foam Madagascar vanilla, and a dusting of sea salt. Like, what? I'm glad I just got a plain black coffee. I'm a plain black coffee guy all the way. It's delicious. When people ask me what I want with my coffee, I say I'll have coffee with my coffee. But here's the thing. Now, when I pulled out my charge card to pay, the barista said, just so you know, there's a small surcharge. There's a small surcharge for using a credit card. I was a little surprised at first, but then I looked around and nobody else seemed to mind. I see other people whipping out their credit cards like there's no tomorrow. I'm thinking it's been really common these days. I mean, you see it at restaurants, retail stores. Even my dog groomer is charging a surcharge on the credit card. And it makes sense in some ways. The business gets to keep 100% of the sale. And the customer, me, I made the choice to use the card. Personally, I'm doing it for the points. I love racking up points on my Amex and then flying free. So I made that choice, and I'm willing to pay a small little fee for it. It's one thing to pay a few cents for coffee, but how about when a patient is getting a $1,500 crown and you got to suck up the percentage on that? Wouldn't it be nice to give patients a choice and see if they want to use their credit card and actually pay a tiny percentage for the privilege? And I've seen this as a new trend in dental practices. It's called surcharging. The patient covers the processing fee. You get 100% of the fee without any percentage going to the processor. I mean, it's really become cop gas stations have been doing it for decades, but it's now finally just hitting businesses and professional industries and people like us. So what's the catch? Well, for some practices, it might feel a little cheap or sleazy or greasy. I totally get it. I understand if you think it's not right for you, but for others, it can be a real easy way to boost revenues without raising your fees because you don't have to pay anything. Now, I love stacks for credit card processing because you don't have to pay the overage. But with the method where the patient pays a surcharge, you don't have to pay anything. You don't even have to pay Visa, MasterCard, or Amex. A bunch of people have asked me about this, and that's why I'm recommending Cardex. If you want to explore surcharging, check it out. They make it simple, it's compliant, it's transparent, and you can decide if it's right for your practice. If you want to learn more, just go to maddow.com/Cardex, MADOW.com/CARDX. And they can even tell you how much you'll save and how it will improve your practice's bottom line. So check it out. You can keep 100% of your fees without raising them. Expenses are going up, reimbursements are going down. If you feel this is right for your practice, it's a personal decision. But if you feel this is right for you, go to maddow.com/Cardex, MADOW.com/CARDX. Okay, let's move on to an old business fable that I'm often pulling out these kind of like old business fables to use for dental practice metaphors. I find a lot of times at a seminar, if somebody asks me a question, I'll utilize an old business fable to answer it. And then, of course, drive the point home with how it relates to dentistry. But there's one that I've always loved. And maybe it's because my dad owned a small shoe factory in Baltimore. So it hits kind of close to home. But the fable, whatever you want to call it, the business story is a shoe company owner sends his two sons to a remote island to check out the potential there. Can we sell shoes here? And a few days later, one writes back. He says, Dad, bummer, man. No opportunity. No one here wears shoes. And the second one sends a message that says, Dad, amazing opportunity. No one here wears shoes yet. See what's going on here? The same island, same situation. Everything's the same except the sons, who came to two completely different conclusions. People in the island are barefoot. One son says, no chance to sell shoes here. They just don't wear them. The other son says, most amazing opportunity here ever. Nobody's wearing shoes yet. And I've seen this in dental practices. We face what I'll call shoe island moments just about every single day. One place I see it all the time is when a practice is doing very little perio treatment. I'm telling you, I've consulted with a practice before. They have a perio percentage of like 3%, which means 3% of their patients are either undergoing periodontal therapy or they're in perio maintenance. Now, we all know that way over 50% of adults in the US have some form of perio disease. So, how can you explain a perio percentage of 3%? People have actually told me things like, well, in this community, nobody has perio disease. That's amazing. And it's not true. It's typically a dentist who just finds it easier to only present restorative treatment, and hygienists who are comfortable being cleaning ladies and doing bloody prophies. It's just easier. If we don't talk to the patient about perio disease, we'll just clean them up as best we can and send them on the way to the doc for their crowns. Nobody wears shoes in this practice. At least nobody wears perio shoes. But I guarantee you, if the exact same practice with the exact same patients gets more serious about doing a really thorough perio exam, diagnosing periodontal disease, let the patients know what's going on, their periotherapy department will skyrocket and the patients will be healthier. I'm going to give you one quick tip here. It's one of my favorite tips. And it has to do with the old technique. Some people call it the talk over technique, where you actually inform the patient what's going on during the exam. Oh my gosh, can you believe that? You actually inform the patient. So, docs, hygienists, from now on, when you do your perio exams, your periodontal probing, first start by telling the patient why you're doing it and how important it is. Patient, that's a horrible name. Let's pay, maybe the patient's name is patient. That makes it easier. Patient, we're going to do a periodontal exam now, which is a really thorough examination of your gums and your gum tissue. And we're checking for bleeding, inflammation, and infection. You may not know this, but more adults lose their teeth to gum disease, this inflammation and infection, than to any other reason. And that's why we're really, really careful about doing a thorough job with this. Now, notice everything I'm saying is plain English, understandable by a fifth grader, especially this part. The way we check your gums is we use an instrument. It's like a little ruler, and we're checking to see how tightly your gums are attached to your teeth. Everybody understands this, right? We're going to use a little ruler. It checks how tightly your gums are attached to your teeth. I'm going to be calling out a series of numbers. Low numbers are usually good. If you hear one or two or three, that's usually really good news. If the numbers get a little higher, like a four or a five, that's a sign of possible inflammation and infection. And if you hear me say the letter B, it won't feel any different, but that means when the little ruler touches your gums, I actually see a little bit of bleeding. That's pretty much a sure sign of inflammation and infection. So you're doing the perio exam. The patient hears 323, 435, 535B. Before you even say another word, they know they've got inflammation and infection. Yuck, grody to the max in their gums. And when you sit them up, they're going to say, what can we do about this? So do your perio exams this way. It's such an easy tip. Get your patients involved. They will ask you for periotherapy. Some other barefoot patient moments. No one in our area ever asked about clear aligners. Patients don't want fluoride. They can't afford it. We're in network. All these things are the barefoot island paradigms. So are you going to be the son who says, nobody wants fluoride, nobody wants clear aligners, they can't afford it? Or are you going to be the son who says, wow, none of our patients have been exposed to fluoride treatment yet? That's fantastic. Are you going to be the dentist who says, none of our patients have been given the opportunity to get clear aligners yet? I love Simply Clear, by the way, by OrthoBrain. You can find out more at matto.com/ortho. That's your choice. The problem can become the opportunity, and it just requires looking at things through a different lens. There's a good chance that your patients are walking around barefoot after all, but they're hoping to be offered shoes. Wow, crazy metaphors there. I love metaphors. And speaking of metaphors, it's time to ditch the metaphors and go to our mystery shopper calls. I just want to remind you, if you want to Check out credit card processing with surcharging so you don't pay a dime, not one dime. And your patients kind of pick up the tab. Go to matter.com/cardx, CARDX. If you want to get in touch with me, my personal email is rich, that's RICH, at maddow.com, rich at MADOW.com. And let me know about your local study club or dental association. I'd love to come do a presentation there. So much fun. So great for the entire team. Let's do some mystery shopper calls. I think I had perio on the brain after writing this week's podcast. So these mystery shopper calls have to do with, I think, what would happen if I called a practice and said I was told I have a 5 millimeter pocket? How would they respond to that? Let's find out. Here we go. Call number one.
Good morning, Dental. This is Jess. How can I help you?
Hey, Jess, I have a question. At my last dental appointment, it wasn't with you. It was like 8 months ago. They told me I had a 5 millimeter pocket, but never really explained that. What does that mean exactly?
You said your appointment wasn't with us?
Yeah, it was with another office.
So what that means is when they are probing to check for bone loss, there's an open pocket in your gum where the probe can go down farther than it should.
Oh, that sounds horrible. And what do you mean they're checking for bone loss? I don't remember them doing anything with my bones.
Well, that's part of what that is. It's just checking to see how much recession there is.
Okay, I didn't think we were in a recession right now. I don't know. I don't read the news that much. Okay.
Yeah, unfortunately, not that kind of recession.
Oh, okay. So just to be clear, they were checking for bone loss, and there was a open pocket there,
yes.
And gum recession. Okay,
Right.
I see. Okay, good. Well, I really appreciate that. Thank you so much.
No problem. Thank you.
Okay, bye.
Bye.
Okay. A number of things went wrong here. Mainly, of course, this is a wide open opportunity to say the best thing to do is to have you come in so we can check and see if you do indeed have that 5 millimeter pocket and how we can help you. No attempt to get me in. She used terms like bone loss, recession, open pocket. Not only did she use patient unfriendly terms, but she used them inaccurately. We'll talk more about this call, but let's play one more, then we'll kind of sum up this whole deal. Let's rock.
Thank you for calling Dental Care. To get you to the best team member, please select from the following menu. If you are considering becoming a new patient, please press 1. If you are an existing patient, please press 2. For all other questions for our office team, please press 3.
Your call may be recorded for quality and training purposes.
Oh, yeah, I'm shaking in my boots, man.
Dental Care, this is Emily speaking. How may I help you?
I have a question for you. My last dental appointment, it wasn't at your office, it was somewhere else, but it's about 8 months ago or so, and they told me I have a 5 millimeter pocket. But do you know what that means? Like, they didn't really explain it to me.
Yes, sir. So part of the comprehensive exam by the hygienist involves what we call perio charting, which is where they measure the pocket depths around the tooth, around each tooth. And ideally, you are looking for a number between 1 and 3 to be considered like healthy standard gum. When you get into the 4s and 5s, that is when you start to see inflammation and what we call periodontal disease. So that just means that it's essentially bone loss of the tooth at the root. So with those types of measurements, typically you would be treatment planned and recommended for what we call SRP, which is a scaling and root planing, which is just a bit of a deeper, like gum therapy cleaning than your standard prophylaxis.
Wow, so it's not like an operation or anything.
No, sir. It's done in office. Sometimes they will give a little bit of local anesthetic depending on how sensitive you are. But it is something that the hygienist just does here in the office.
And what's a standard prophylaxis?
So that's just what we kind of call a healthy mouth cleaning. So if you were to come in and just get a standard like 6-month cleaning, and your mouth was at that point where, there was no inflammation, no deep pocket depths, no need for any scaling in the gums, then the prophy is what it's called. That's just like a regular cleaning.
Got it. Okay. I think that's a very clear picture. Thank you so much.
You are very welcome. Let us know if there's anything we can do for you.
I absolutely will. Thanks.
Yes, sir. Have a good one.
You too. Bye.
Bye-bye.
Oh man, I thought she was going to close it to the end and say, "You're welcome. Let's get you in for an examination." But she just said, "Let us know if there's anything else we can do for you." A couple more things about this call. I really didn't care for that DJ voice in the beginning. Thank you for calling our dental office. If this is a new patient, push what? To me, it just sounds extremely corporate. Now, I don't know anything about this office, whether it's corporate or not. I don't think you want to go for that corporate sound. I just didn't like that at all. I love the term she used, a healthy standard gum. 1 to 3 means a healthy, it could be like a new dental term, an HSG, a healthy standard gum. She was nice, pretty knowledgeable. She wasn't 100% clinically accurate, but we'll say close enough, right? I think she used way too many dental terms. I think if she would have explained things the same way, but used much more patient-friendly terms, the call would have been better, but not bad and friendly, voice, great attitude, there to help. All those things were good and positive. Again, I'm not saying she hit every mark, ticked every box, as they say, but pretty darn good enough until the end when she didn't say, "Let's get you in for an examination. That's the next step. Let's see what we think." Whatever. Man, she was so close. But in the end, let the patient hang up. No contact information, no attempt at an appointment. So this patient is lost and gone forever. But I hope you're not lost and gone forever. So if you haven't subscribed yet, I think like 64% of our listeners and viewers are not subscribed. So please, in whatever format you're using, whether it's YouTube or Apple Podcasts, Spotify, anything, subscribe so you get instantly instantly when a new episode comes out. You can be one of the first to listen. Tell your friends. I'd really appreciate it. You'll help the podcast grow so we can do bigger and better things. And if you want to contact me personally, my email address is rich@madow.com, RICH@MADOW.com. I'd love to come speak to your association or study group. And I'll see you in the next episode of the Dental Practice Fixers podcast. Thank you so much. Bye now.